The surgical tenet of Argentinian flag sign in an intumescent mature cataract. The Argentinian flag sign typically arises after an initial puncture of the anterior capsule, following which self-propagating tears radializes rapidly in two opposing directions to the periphery of the anterior capsule in an undesired and uncontrolled fashion. This situation made me relate to the Tenet movie by Christopher Nolan, where the Argentinian flag sign asks me, "How would you like to die?" Me be like, "Die old," for which the Argentinian flag sign responds intimidatingly, "Then you have chosen the wrong profession." This sign was first described by Daniel Mario Perón in 2000, where one can appreciate two vectoral forces acting opposite in direction radially once the nick is made with a cystitome, visually depicting an Argentinian flag sign. In the case for presentation, once the nick was made, not two but three vectoral forces, that is Triquetral forces, acted, causing three radial tears up to the equator. In this surgical case, there were three anterior capsule radial flap tears along with an iatrogenic corneal tear at the side port. Once the nick was made, there was an inverse Y-shaped tear starting to propagate equatorially, and due to sudden withdrawal of the cystitome outside the anterior chamber as a shock response by the novice surgeon, an iatrogenic corneal tear was made. So, the complication of Argentinian flag sign with a damaged side port was now on my plate to manage. The novice surgeon had so many questions in his mind, such as, "You still want to proceed Phaco-Emulsification for this intumescent mature cataract even after the occurrence of Argentinian flag sign?" "Well, yeah," was my response. The next question that popped was, "In the bag Phaco, or do you want to bring the nucleus into the anterior chamber and do Phaco?" Well, that part is a little dramatic. Let's have a look. Once that particular complication had happened, I wanted to secure the side port corneal tear to have a steady anterior chamber during Phaco maneuvers. Any fluctuation in the anterior chamber will only further propagate the equatorial tears into the posterior capsule. Slow motion Phaco-Emulsification was proceeded to minimize the stress on the zonules. This is a fast forwarded video of stop and chop Phaco with parameters comprising vacuum of 400 mm of mercury, aspiration flow rate of 26 ml per minute, and the bottle height was 80 cm. Nucleus management was done within the bag. Quadrant was also emulsified within the bag, with a few quadrants emulsified in the supracapsular plane. Quadrant removal was also managed meticulously with the reduction of Phaco parameters. Another paracentesis was placed for comfort of cortex aspiration. Mindful cortex aspiration was the key without capturing the remnant anterior lens capsule. There is a guided animation on the bottom left provided to depict the creation of a circular edge for one apex of the anterior capsular flap remnant, followed by residual cortex aspiration. The idea was to try and create a circular axis with the three triangular flaps so that IOL can be placed in the bag. The remaining two triangular capsule flaps was also nicked with microrhexis scissors and was converted into a circular edge with a microrhexis forceps. Circularity was tried keeping in mind that the surface of the anterior lens capsule would adequately be able to cover the optic of the IOL. At the end, we had a circular axis with three radial tears. The side port was reinforced with 10-0 nylon to prevent inadvertent leak from the anterior chamber. Then, a 3-piece sensor lens was placed in the bag. The most important point for IOL placement here was the optics of the IOL were consciously placed away from the three radial tears. This animation module reveals the mental mapping strategy and how the optics were placed away from the equatorial tears. This is the post-op 1 month and 1 year picture respectively, revealing that the IOL was well centered in the bag with a good overriding of the circular axis over the optic with best corrected visual acuity of 6.6 and a happy patient. In this surgical tenet, where the title is inspired from the Christopher Nolan's time inversion movie Tenet, there are some focal take-home points to be addressed for the neophytes. This is a scene from the movie Tenet, where Robert Pattinson asks John David Washington, for which Washington, who knows things before it happens, replies, "It hasn't happened yet." Concept of time inversion is something that I would love to propose for the management of Argentinian flag sign. But in reality, we can't really reverse time and prevent it as seen in this video. If only time inversion was that simple to prevent Argentinian flag sign. Because in reality, time travel is not possible. So, prevention is always better than cure. The following points can be kept in the mind of neophytes while encountering and preventing the Argentinian flag sign. Point 1. Preventing Argentinian flag sign by creating an inverted T-rexis. The intralenticular pressure of an intumescent cataract can be reduced by injecting a 26 gauge needle faced bevel down and performing a graded suction with a glass syringe. The idea then is to perform two hemicircular rexes with two flaps, one from the clockwise direction and the other from anti-clockwise direction. So, in scenarios where one flap extends to the equator, there is always another flap present for achieving and completing the circular rexes. Point 2. For novice surgeons who end up with a small rexis, there is always a second chance for expanding the rexis if needed after IOL placement with microrexis scissors and forceps. This step is particularly important to prevent inadvertent capsular phimosis in the future. Point 3. Management after Argentinian flag sign has happened in SICS surgery. Don't panic. Aim for a circular capsular rexis with the help of microrexis forceps and scissors or 1R scissors and Utrata forceps. Try to maintain rexis circularity as much as possible. Then deliver the nucleus and proceed with IOL implantation by placing the haptics away from the radial tears. By following these surgical tenets, one can break the hedonic cycle of Argentinian flag sign to gain access to a new world of wonder and joy. Thank you.